The truth behind vitamin D deficiency. In today's society, everyone is always so busy and sometimes even too worried about other things besides their own health. In that case, it should be more aware to people about vitamin and mineral deficiencies going on around the world today. According to CDC's second national report of the U.S. general population, a study was conducted in 2003 and 2006 based upon deficiencies, vitamin D ranking in the top 3. Vitamin D deficiency is now a global public health problem affecting more than an estimated 1 billion people worldwide. Although vitamin D deficiency is incredibly common, many Americans believe that although they consume vitamin D fortified foods such as milk, that they are not at risk, and that is false. Some people may wonder what exactly are the causes of vitamin D deficiency, and if it is related to genetics, dietary requirements, or even other relative groups. Vitamin D is only found in a few different types of foods naturally. For example, it may be found in fish liver oils, mushrooms, fatty fishes, liver, and also egg yolks. In the United States, it is common to have vitamin D added to the milk as well as a few different other types of foods. The sun is also a great way to get vitamin D to your body. The ultraviolet light from the sun helps people photosynthesize vitamin D into the skin. It is then transported into the liver and converted into 25-hydroxyvitamin D. It is known that in relation to vitamin D deficiency, some populations have been more affected by either gender, race, or ethnic groups. Clinical data shows that non-Hispanic blacks have better bone health, greater bone density, and fewer fractures than other race and other ethnic groups. Non-Hispanic blacks, which counts for 31%, and Mexican Americans, which count for 12%, people were more likely to be vitamin D deficient compared to non-Hispanic white people, which counts for 3%. Males and females also had similar levels of deficiency, and levels generally decreased as age increased. Among the three race and ethnic groups, non-Hispanic blacks had the lowest 25-hydroxyvitamin D levels, and non-Hispanic whites had the highest levels. There are only a few symptoms related to vitamin D deficiency. Some of the symptoms include muscle weakness and bone pain, and for many, the symptoms may be subtle. Rickets disease has traditionally been recognized by vitamin D deficiency, in which the bone tissue doesn't properly mineralize, which leads to soft bones and skeletal deformities. Vitamin D is very important for the health of your bones by helping the body use calcium from the diet. It is also shown to be an important role for muscle strength, as well as protecting against type 2 diabetes and cancer. Studies show that it may even reduce fibromyalgia pain and slow the progression of multiple sclerosis. Low blood levels of vitamin D have been associated with an increased risk for death by cardiovascular disease, cognitive impairment in older adults, severe asthma in children, and even cancer. In the case of how common vitamin D deficiency is, it is very important to try and alleviate your vitamin D deficiency that you may have due to the roles that it does take on your body. This deficiency could be alleviated by trying to focus on foods that have more vitamin D, sitting in the sun to get more ultraviolet rays, as well as taking supplements. Along with that, it is also very important to eat a well-balanced diet, get plenty of sleep, have regular doctor checkups that include blood tests, exercise regularly, as well as using SPF sunscreen before sitting in the sun. Thank you.